Principles of Oncology. Oncology, the branch of medicine that deals with the prevention, diagnosis, and treatment of cancer, is guided by fundamental principles that ensure effective and patient-centered care. These principles encompass the understanding of cancer biology, diagnosis, staging, treatment, and supportive care. Below is a detailed outline of the principles of oncology. 1. Understanding cancer biology. Cancer arises from genetic mutations leading to uncontrolled cell growth. Key aspects include hallmarks of cancer: sustained proliferative signaling, evasion of growth suppressors, resistance to cell death, apoptosis, enabling replicative immortality, inducing angiogenesis, activation of invasion and metastasis. Genetic basis: mutations in proto-oncogenes, tumor suppressor genes, and DNA repair genes. Epigenetic alterations: tumor microenvironment, interaction of cancer cells with immune cells, and extracellular matrix. PET 2. Principles of cancer diagnosis. Accurate diagnosis is critical for effective treatment planning. Clinical evaluation: history taking for risk factors, e.g. smoking, family history. Physical examination for palpable masses or lymphadenopathy. Diagnostic imaging. Techniques include X-rays, CT scans, MRI, PET scans, and ultrasound. Biopsy, gold standard for diagnosis. Types: fine needle aspiration, FNA, core biopsy, incisional-excisional biopsy. Histopathology, examination of tissue samples for cancer type, grade, and molecular markers. Molecular diagnostics, identification of mutations, e.g. EGFR, BRCA5, and biomarkers, e.g. HER2, PDL1. 3. Cancer staging and grading. Staging determines the extent of disease spread, while grading evaluates tumor aggressiveness. TNM staging system: tumor size and extent. N. Lymph node involvement. M. Presence of metastasis. Grading, based on cellular differentiation. Grades range from well-differentiated, low grade, to poorly differentiated, high grade. 4. Principles of cancer treatment. Treatment is tailored to the cancer type, stage, and patient factors. A. Surgical oncology, curative resection for localized tumors. Palliative surgery for symptom relief. Reconstruction after tumor removal, e.g. mastectomy. B. Radiation oncology, use of ionizing radiation to destroy cancer cells. Techniques: external beam radiation, brachytherapy. Side effects: skin reactions, fatigue, secondary malignancies. Systemic therapy, chemotherapy, cytotoxic drugs targeting rapidly dividing cells. Side effects: myelosuppression, alopecia, nausea. Targeted therapy, drugs acting on specific molecular pathways, e.g. tyrosine kinase inhibitors. Immunotherapy, enhancing the immune response to target cancer, e.g. checkpoint inhibitors like pembrolizumab. Hormonal therapy, blocking hormone receptors in hormone-sensitive cancers, e.g. tamoxifen in breast cancer. Gene therapy, experimental treatments targeting genetic defects. D. Multimodal therapy, combining surgery, radiation, and systemic therapies to improve outcomes. 5. Supportive and palliative care, ensures quality of life for patients with advanced or incurable cancer. Symptom management, pain control with opioids or nerve blocks. Management of nausea, fatigue, and dyspnea. Psychosocial support, counseling and support groups for patients and families. End-of-life care, focused on dignity, comfort, and hospice care. 6. Principles of primary prevention, lifestyle modifications, e.g. avoiding tobacco, healthy diet. Vaccination, e.g. HPV vaccine for cervical cancer. Secondary prevention, early detection through screening, e.g. mammography for breast cancer. Tertiary prevention, reducing recurrence or complications through regular follow-ups. 7. Principles of cancer research and ethics, clinical trials, essential for discovering new treatments and improving care. Phases: I. Safety. 2. Efficacy. 3. Comparison with standard care. Ethical considerations, informed consent, confidentiality, and patient autonomy. 8. Personalized oncology, tailoring treatment based on individual patient characteristics. Precision medicine, use of genetic and molecular profiling to guide therapy. Pharmacogenomics, understanding how genetic variations affect drug response. 9. Survivorship care addresses the long-term health and well-being of cancer survivors. Rehabilitation, physical therapy for recovery. Surveillance, regular follow-ups to detect recurrence. Psychological support, addressing anxiety, depression, and fear of recurrence. 10. Future directions, development of novel therapies, e.g., CAR T cells, oncolytic viruses, advances in early detection technologies, e.g., liquid biopsies, integration of artificial intelligence in oncology for diagnosis and treatment planning. Conclusion. The principles of oncology revolve around a comprehensive approach to understanding, diagnosing, and treating cancer while focusing on patient-centered care. Advances in research, technology, and personalized medicine continue to refine these principles, offering hope for better outcomes in the fight against cancer.